So Margaret is a 32-year-old woman who has come to counseling through a referral from her primary care doctor. The doctor simply stated generalized anxiety as the reason for the referral. Her symptoms started about a year ago when she was out shopping one day and began feeling anxious, nervous, and panicky. But those symptoms went away after a few minutes, so she carried on shopping. However, about 2 weeks later, the same thing happened and the symptoms were worse. This time, her psychological state affected her biological state, so she could feel her heart beating faster and she thought she was going to faint. It takes a real effort for her to go out because she already gets anxious even before she goes out shopping. So sometimes she avoids the situation. She has dreadful feelings and sometimes bursts into tears for no reason. Recently, about a week ago, she went out to do weekly shopping. She was in the shop and began feeling a bit breathless and nauseous. She reports that she felt embarrassed and thought everybody was looking at her and thinking that she was so stupid. So she also got pain in her chest, but she told herself that it was panic. So she left the shop, but after 10 minutes, she went back into the shop and finished shopping. So she felt really proud of herself. To diagnose her situation, deriving from her symptoms, Margaret is most likely to be diagnosed with panic disorder related to agoraphobia. Unlike what her doctor diagnosed her with, which is the generalized anxiety, Margaret's symptoms are related to a particular situation, in her case, shopping. Panic disorder is diagnosed or shopping in like shopping malls where a lot of people are. Panic disorder is diagnosed in people who experience spontaneous, seemingly out of the blue panic attacks and are preoccupied with the fear of a recurring attack. Some people stop going into situations or places in which they've previously had a panic attack in anticipation of it happening again. These people have agoraphobia, and they typically avoid public places where they feel immediate escape might be difficult, such as the shopping malls, public transportation, or large sports arenas. In Margaret's case, it's the shopping mall. An interesting fact is that about 1 in 3 people with panic disorder develops agoraphobia. Margaret might have developed this kind of anxiety from experiencing fear of social situations in her childhood, which could be a predisposing factor. Another factor that we could think about is that she might have had some problems that would cause her to be more vulnerable for stress, such as relationship problems or sudden happening of emotionally draining situations, which could be precipitating factors. According to Mauer's two-factor model, Margaret might have linked her panic attack to the act of shopping, which is the conditioning, and the avoidant behavior reinforced anxiety. Also, according to the research, women are twice as more likely to develop anxiety disorders than men. So for treatment interventions, keeping a thought record for a week, noting about when her thoughts were negative according to frequency, duration, and intensity could help her see the objective perspective of her disorder. And also going to the supermarket where the last occurrence had happened each day could help her desensitize by exposing to situations that she thinks is threatening. Thirdly, focusing on breathing and positive self-talk whenever she feels anxious could help Margaret to stop physical symptoms from happening. Lastly, reading the self-help guide recommended by the therapist could help her increase her awareness of the disorder and also help her to react to symptoms more wisely and more quickly. Because Margaret is motivated for therapy and for change, she seems to be strong enough to overcome her disorder. Furthermore, she already broke herself the pattern of avoidance and felt proud of her achievements. Therefore, she is already in the process of overcoming her disorder.